is a very important topic as far as examination is concerned. If you read the different types of books, many books have made a lot of complication in this understanding of this topic. If you go through my book, this topic I have made very, very easy. Just compare with the other books, then you can understand what is the difference between them, how to elaborate this topic, how to understand this topic. This is a very simple topic. Name is leprosy. Leprosy is also called as Hansens disease. Leprosy means Kushtarog, Maharog, you may be knowing. This leprosy is caused by a disease agent called as Mycobacterium leprae. Leprae. So, tuberculosis is caused by Mycobacterium tuberculosis. Mycobacterium leprae causes the Hansens disease or leprosy. Why it is named the Hansen? The name of the scientist was Hansen. He discovered this disease in 1873. That's why this leprosy is called as Hansens disease. First time Mr. Hansen discovered the Mycobacterium leprae bacilli before the Mycobacterium tuberculosis bacilli. Mycobacterium tuberculosis bacilli was discovered by Robert Koch in 1884, while this was discovered by Hansen in 1873, 10 years before that. So now coming to the show, this is about the introduction of the disease. If you go through the history of this, initially it was been said that this disease was caused in India. This disease was caused because of curse of a goddess, but that is not true. Second thing is, in Italy, this disease is caused as what we called as leprosy. First time they called it as leprosy because leper means scaly. The scales are seen. So there is a skin involvement. So the skin becomes little bit rough, shiny, or hypopigmented, or sometimes erythematous. So either this disease is not caused by a curse of a god, nor this disease is caused by any other things which have been labeled for this. But this has been definitely proved that this disease is caused by Mycobacterium bacilli, and the person who comes in contact with this disease for minimum 3 to 5 years, he is likely to get the disease. So how many persons likely to get the disease? If 100 persons are staying together, and among the 100 persons, if a single person is suffering from Mycobacterium leprae, and that single leprosy patient comes in contact with those 100 patients, the incidence rate is 4.4% if there is a close continued contact with the leprosy patient. If the normal patient comes in close continued contact with the leprosy patient, CCC, then only this disease is prevalent. So incidence is 4.4% per 100%. So if you go to the what is the epidemiological distribution pattern of this disease in world, this disease is seen in each part of the world, but most commonly seen in the South Asian countries like India, Myanmar, Pakistan, Sri Lanka, Bangladesh, Indonesia. So Southeast India is the most, why this is more commonly seen in Southeast India, when I will consider this social factors I will discussing later. Now, what is the distribution pattern in India? In India, this disease is known to us from ancient era. But this disease is more commonly seen in the states like Tamil Nadu, Bihar, then Jharkhand, then Orissa. So these are the few diseases, even in Madhya Pradesh, where this disease is more commonly seen. So initially only one drug was used for this, that is called as monotherapy. The drug used was Dapsone, which is effective against this disease. But now Dapsone, only one drug cannot be used against the disease, because this disease has the ability to involve each and every organs of the body. Every system is affected by this disease. So now there is a study which has been taken in Maharashtra, in the college, medical college called Mahatma Gandhi Institute of Medical Sciences, Sevagram Murda, near Nagpur, where first time they studied how many drugs can be used for this, and they have given the name for that treatment called as multi-drug therapy disease. Against, means many drugs has to be used against the complete treatment from the leprosy. So that I will discuss when I will discuss the prevention and the treatment part. Now coming to what are the types of leprosy. See, this disease mainly involves the skin, but it can involve the other parts like ear, nose, fingers of hand, fingers of toes of the lower extremity, and this disease can involve the bones, cartilages. So each and every organ can be affected by the leprosy. So depending upon that, this leprosy is classified under 4 types: lepromatous leprosy, tubercular leprosy, borderline leprosy, and neurotic leprosy. Means what? But among these 4 types, lepromatous leprosy is most infectious. Lepromatous leprosy is most infectious because the patient who is suffering from the lepromatous leprosy, he has the mycobacterium leprabacilli in the nasal secretions. So whenever the patient coughs, whenever the patient sneezes, he gives out the mycobacterium leprae through the nasal secretion. And these mycobacterium leprae are very much resistant. So mycobacterium leprae which are sneezed out, they can deposit in the conjunctiva, in ear, in eyes, in the oral cavity, or if there are open wounds on the face or the external surface of the hand, if they get deposited there, then this patient may get the infection. So lepromatous leprosy is more infectious than the other borderline, tuberculoid, and the neurotic type. There is one more classification of this leprosy, types of leprosy, given by the Hinda Kushta Nivaran Sangh, and this classification is based on clinico-bacterial presentation. Means what is present clinically and whether the bacteria are present or not. On this basis, the clinico-bacterial basis, these diseases also classified under 5 things: lepromatous, borderline, neurotic, tuberculoid, intermediate. So these are the 5 diseases. Clinico-bacterial means, see, there are clinically this disease presents like, I always tell you that, remember P4 for clinical conditions, describe the clinical conditions of leprosy. P4 means, first is for presence of hypopigmented patches on the external aspect of the skin. Presence of P, first P, presence of hypopigmented patches on the external surface of the skin. Second P is for presence of palpable nerves. Palpable nerve, thickened palpable nerve. So palpable nerve, which nerve we can palpate is the ulnar nerve. Here in the olecranon fossa, middle aspect. Ulnar nerve becomes thickened, palpable, tender. Second nerve is external auricular nerve, thickened, palpable, tender. Third nerve is lateral aspect of the lower leg, called as lateral popliteal nerve, which curves around the neck of the fibula. That is, the lateral popliteal nerve becomes thickened, palpable, and tender. So these are the nerves, and God has always given the two nerves where you can compare lateral this ulnar nerve on both hand, auricular nerve both side, lateral popliteal nerve on the at the present at the neck of the fibula. So how to know whether it has been palpable? This nerve becomes thick, this nerve becomes tender, and you can easily palpate. And while palpating, the nerve becomes tender, painful. So first P is presence of hypopigmented patch. Second P is presence of thickened, tender, palpable nerves. Third P is presence of loss of sensation. So first sensation which remains absent for light touch, sensory. If you try to touch, patient is unable to feel the sensations. So third is many presence of nodules on the ear or on the upper on the eyebrows, on the face or the external aspect of the body. So these are the 4P clinical features. Now coming to what are the epidemiological factors. Epidemiological factors are described under 3 headings: agent, host and environment. Agent is Mycobacterium leprae. Where it presents into the nasal mucosa, in the nasal secretions. These are the acid-fast bacilli. If you stain with a Gill nasal stain, this bacilli can be seen under the microscope. So acid-fast bacilli, the Mycobacterium tuberculosis is acid-fast, A positive acid-fast bacilli. Similarly, Mycobacterium leprae is also acid-fast bacilli. This bacilli present into the nasal secretion, number 1. Number 2 is this bacilli can be present into the wet nasal secretions for 46 days. See the period of infectivity of this Mycobacterium leprae. So in wet nasal secretion, this bacilli survives and has the maximum infectivity power for 46 days. But in dry nasal secretions, this bacilli survives for 9 days. 9 days. So this is all about the agent. Here host is the human being. This disease is seen in all the age groups, right from small kid up to the elder persons. Both the sexes are more equally affected, but this disease is more commonly seen in male as compared to female. Next is the in host is the environmental factor. This disease is more commonly seen where there is a lot of moisture, weather is cold, more in those areas. This leprosy is more commonly seen. Social factors like overcrowding, lot of moisture in the atmosphere. Many people are living in a room, means lack of ventilation, where this disease is more commonly seen. So leprosy is called a social disease which has got the medical aspect. Social disease which has got the medical aspect. Now what is the mode of transmission of disease? There are 3 modes of transmission of disease. Number 1 is direct infection. If the person sneezes, coughs, his nasal secretions contains the Mycobacterium leprae and they can infect the normal person. Number 2 is if this person, even the leprosy patient, if he has the open wound or a cut, that wound may contain the Mycobacterium leprae. Third is this disease can be transmitted but not proved from mother to child. But still the research is going on this. Now how to diagnose? Diagnosis is very simple. Ask the person, first examination the person. Ask the person to remove all clothing. Patient has to be examined naked under the sunlight, not in the artificial light. If under the sun rays, if the normal light, they are examined, you can see the hypopigmented patches. And in that hypopigmented patch, as I told you, the touch sensation is not there. So touch sensation goes first in leprosy. Number two is you can search for the palpable nerves, ulnar, gastroauricular or a lateral popliteal nerve. Third is you can search for the nodules on the eyebrows or on the external aspect of the skin. You can look for the depressed nasal septum. You can look for the claw hand or a claw foot, because in the advanced stage of this disease, the bone is absorbed by the Mycobacterium leprae, and the patient develops bony deformities like claw hand, claw foot, foot drop, depressed nasal septum. So diagnosis. Diagnosis is done by the examination under the normal day-to-day light, not in the artificial light, under the artificial light. Usually in what we call as ventral aspect, patient can see the hypopigmented patch. But in many patients, these hypopigmented patches are seen on the back and the buttock. So the patient has to be examined. So as I told you, patient has to be examined naked. Then only you can see the hypopigmented. And if there is a history of close continued contact with the leprosy, the patient has to be examined thorough. Look for the deformities, look for the depressed nasal septum, look for the hypopigmented patches, look for the bony deformities like claw hand, foot drop, or the presence of tropical ulcer. Tropical ulcer is seen on the plantar aspect. Tropical ulcer are seen, the short note is asked on the tropical ulcer in surgery, not in community medicine. So tropical ulcer means, as I told you, first goes is the touch sensation. So even if the wound occurs there at the plantar aspect, patient will not get any pain. That's why look for the tropical ulcer. So first is the examination for diagnosis, and it has to be supported with the biochemistry. So in biochemistry, what you can do is you collect the nasal smear, do the Hill-Nelson staining, and look for the positive acid-fast bacilli, that is Mycobacterium leprae. Number one. Number three is histopathological examination. Means you have to take the skin patch for looking for the Mycobacterium leprae. From 7 sides, the skin patches are taken. Number one is right ear, left ear, and nose. These are 3. And remaining 4 skin patches are tested histopathologically for presence of Mycobacterium leprae from the first skin involvement patch, second patch, third patch, fourth patch. So 1, 2, 3, 4, first hypopigmented patch, skin biopsy from the first patch, second, third, fourth patch. So these 7 sites has to be collected for examination of the Mycobacterium bacilli and has to be seen under the microscope. Then you can label the patient as the leprosy. The treatment and the control part I will discuss next.